have low back pain. I've had multiple surgeries to get my back, try to get it in order. So I made this video to possibly help someone else out who's been in the same situation. I looked at multiple YouTube videos when I was researching the back surgeries, and I just wanted to give back because I got a lot of information from those. Some good, some not so good, but it beat going in blind. So I'm going to read from my notes here because there we go. So my back pain, it initially started with, you tweak your back here, you tweak your back there, and over my lifetime it progressively got worse. It got to the point to where they use the prednisone blister packs, as prednisone is a steroid, and it would work and it would get rid of the back pain. But then progressively as the years went on, my problems hit a head probably about 3 to 4 years ago when the steroids stopped working, and so did the physical therapy. So I'll give you a little bit of my that's not my background here. I've had 3 minimally invasive L4, L5 laminectomy with microdiscectomy. I've had 3 of those within the last 6 months. These surgeries work for some people. Some work different for others. Unfortunately, all 3 of my minimally invasive ones did not work. So, my first one I had in, what was that, July? No, it was June 2013. And we got to the point to where the doctor and I agreed that surgery was going to be my option. So I had the procedure. Checked into the hospital. Not a lot of scarring, some pain after the surgery, but that's to be expected when somebody drills a hole in your back. But I went home after surgery. It was an overnight stay, and within 2 weeks I had herniated the disc again. So I was on leave, temporary disability from work. So within the next couple of weeks, it only took 2 weeks for it to reherniate. Within the next couple of weeks, I was back on the surgery table again. So I had a revision of the L4, L5 laminectomy with microdiscectomy. And I had good results. Both surgeries initially, my left leg pain it disappeared immediately after the surgery. So that lasted for about 3 months. And then when I found out via my pains, my leg pains, my MRIs, the bulge had come back, and this time the doctor said it was bigger, quite a bit bigger than the first one. So I had another surgery. So I had surgeries in June, July. So I was out of work for 2 months at the time. I got myself back to work. Don't put the horse before the cart. I got myself back to work, and through no fault of my own, it herniated again. So this is where I get back to my 3rd surgery. So I had another surgery in December of 2013. This would be the 3rd revision, 3rd laminectomy with microdiscectomy, minimally invasive. It's where they just make smaller scars and incisions to go in there with a tool to take out the part of the disc and any fragments or things like that they would see in there. It lasted 2 days. 2 days after surgery, my pain came back, and it came back with a vengeance. You get the if you're not familiar, you'll get, depending on where your bulge is, it'll go down that side of your body. So I had like lightness, almost like somebody's shocking you, like a lightning bolt shooting down my left leg, and it progressed to the point to where I'd have that feeling in my groin and in my buttocks, both sides. So I knew once that happened, it was back. So my surgeon, who I had for the first 3 surgeries, he had moved his practice, to another state over, to work for a bigger medical organization. So I looked through the pages, actually through the web, for doctors in my area. Yeah, it's almost like a crapshoot to try to find a good surgeon that fits your criteria that you wanna have, and that'll see you. Some surgeons have like a 2-month waiting list to get just to get in to see them. And I went to see one of the doctors who was a partner of my doctor, my former surgeon, and they recommended that I get a TLIF fusion, which is a type, and you can Google it, because I'm not a medical professional and I don't want to get medical advice. I'm just a guy with a bad back. So they recommended I get a fusion. They were kind of impersonal. They, yeah, I had to wait 2 weeks to get in to see the doctor. After that, I had a week of begging them to read my MRI that I had that Friday. So by following Friday, I got into the doctor. They had read it. Oh, you're going to need surgery. This is the type of surgery that I recommend. But they were saying, well, but we can't have your surgery for 2 months, for another month out. Mind you, I'm a working guy like most of you. I go to work every day. And I'd already missed 2 months of work during the summer. My job was there when I came back. But in this economy, you fear losing your job. So in December I had that third surgery. I'm already out from that surgery. It's like 30 days a pop every time I have surgery. So I went to see that doctor, and they recommended, like I said, the TLIF. So I wasn't gonna wait a month. I couldn't afford to wait a month, to have surgery and then be out of work for 30 days to 60 days after the fusion surgery. And if you're not familiar with fusion, they put rods in your back, they harvest some bone material, and in some cases they put a prosthetic in there to build the bone material around so it naturally fuses together. So there's some drawbacks to that, but I'll probably go into that into a later video. So I consulted another surgeon. Luckily, I belonged to a good HMO who was able to get me in to see their doctor, within a week. So he reads my the same MRIs that the other doctor read, and he says, your back isn't bad enough for a fusion. And he showed me areas where, this is still healthy. This is still healthy. Fusion should always be your last resort, for back surgery. So the doctor I had, who's a pretty good surgeon so far from what I see, he recommended the old school surgery where they make the larger incision, and they also went in. It's called I had a revision of the L4, L5 laminectomy, microdiscectomy, but this time they went in and they cleaned it out. It's basically spinal decompression, L4, L5. That's the right term. So what happened was I had my surgery. I'd say I'm post-op day 6 right now. First day was rough. Just getting around. I was using a walker. They got the raised toilet seat and all the other stuff for me to make it comfortable for me at home. So right now I'm recovering from that being my 4th surgery, and the doctor, I really like this doctor so far. He actually came in and talked to me after surgery, which a previous doctor had not. He just sent me his nurse and didn't come back to see me until I had to go back into the doctor's appointment. So my current surgeon, he went in and he had told me there were quite a few bone fractures. He actually showed it to me on his phone. So there was maybe a large piece of disc, and there were maybe 6 different bone fragments, like little shrapnel running around in my back. So, and this was pressing against my spine, which was causing the nerve root to be pressed So what they did with the decompression is they sort of rotor-rooted the area there to give it more space and cleaned everything out. So that's what I wanted to cover for you guys today. And I'll give you some more information on my post-op days and how I got from day 1 of surgery for the 4th time to currently what I am. But I'd like to put this out there, and please respond if you have any questions. I'm not a medical person, but I can give you what happened to me, or I can give you my 2 cents worth, which might not be worth a whole bunch depending on who you are. So thank you. I'll create another video and get it out there as soon as I can. This is Lewis, aka MD Spider. MD isn't for doctor, it's for Maryland. Alright, thank you.